Hello everyone and welcome back. In today's video, we will be discussing another important and common throat condition which is tonsillitis. We're gonna explore its definition, its causes, clinical features, diagnosis, types, management, and lastly, the complications. Okay, so first of all, we're gonna start by the definition. So, what is the definition of the tonsillitis? Tonsillitis is a simply inflammation of the palatine tonsil, which, as discussed previously, are considered one of the lymphoid organs that are located at the back of the oropharynx. Okay, here is the picture showing the tonsillitis, and here the normal tonsils. Tonsillitis can occur alone as an isolation or occur in association with inflammation of the adenoid tissue, we called it adenoiditis, or in association with inflammation of the pharynx as pharyngitis. Okay, causes. As general causes of the tonsillitis divided into viral tonsillitis and the bacterial tonsillitis. Most common encountered cause in the tonsillitis is the viral. Example of the viral causative organism, we have rhinovirus, adenovirus, respiratory syncytial virus, Epstein-Barr virus, which lead to a disease called infectious mononucleosis. Another name for it is the glandular fever. In this disease, the tonsillitis occur as a part of the disease and as a part of the generalized lymphadenopathy. Okay, other causative organisms, influenza virus, coronavirus, and HIV. Okay, regarding the bacterial causes of the bacterial tonsillitis, the most important causative organism not to be forgotten is the group A beta hemolytic streptococcus. Other name is Streptococcus pyogenes. Okay, other causes Staphylococcus aureus, Haemophilus influenzae, and the pneumococcus. Okay. Next is the clinical features. So we're gonna discuss the clinical feature of the tonsillitis, whether it's bacterial or viral. Then we gonna mention the most likely feature that guided us to whether the cause is the viral or bacterial. So in general, tonsillitis could lead to sore throat, painful swallowing or odonophagia, fever and chills, enlarged red or exudated tonsils, tender cervical lymphadenopathy. Most commonly encountered lymph node group is jugulodigastric lymph node, bad breath, which is halitosis, muffled or hot potato voice, headache and fatigue, ear pain, which is referred due to glossopharyngeal nerve, the cranial nerve number 9, as sharing blood supply between the tonsil and the ear, and there is also possibility of the trismus and drooling. Okay. Here is the most likely features that occur with the viral tonsillitis is low-grade fever, sore throat, rhinorrhea, sneezing, and lastly, the cough. In the bacterial tonsillitis in general, causing more severe symptoms associated with high-grade fever, sore throat, and the cervical lymphadenopathy. Okay. Next is the diagnosis. So in general, the diagnosis of the tonsillitis is primarily based on the clinical features and the history. So when you do examination of the oral cavity and oropharynx, we're gonna find enlarged erythematous tonsil plus or minus the presence of the exudate based on the type of the tonsillitis. We're gonna discuss below and the presence of the tender lymph nodes. Okay, there is some test we're gonna do if there is especially if there is a suspicious of the bacterial tonsillitis. So we have the rapid antigen detection test, which is a quick test done for group A, beta hemolytic streptococcus. The other test that is considered the gold standard, especially if the symptoms are highly suggestive of the bacterial tonsillitis, but the quick test is negative. Okay? In other cases, we don't need to do any further test or based only on clinical examinations, especially if the symptoms are suggestive of the viral causes by the presence of the cough, rhinorrhea, and low-grade fever. Okay. Lastly is the imaging. Imaging is needed especially if the symptoms are suggestive the presence of the complications of the tonsillitis as a spreading of the infection to the nearby spaces or any source of abscesses in the deep neck spaces. Okay. Next is the types. So in general, we have 4 types of the tonsillitis. We have acute follicular tonsillitis, acute parenchymal tonsillitis, acute membranous tonsillitis, and acute catarrhal or superficial tonsillitis. So, what is acute follicular tonsillitis? As we discussed previously, in the anatomy of the tonsil, on the medial surface of the tonsil, just let me illustrate this in a diagram. Here at the tonsil, simply, have on the medial surface some like crypt-like, or we called it follicles. When the inflammation of the tonsils is spread to these invagination or crypts, lead to filling of these crypts by the exudation, give us the shape just like this in these pictures here, like dots filling the crypts. We called it acute follicular tonsillitis. Okay. The other type is the acute parenchymal tonsillitis. In this type of acute parenchymal tonsillitis, when the inflammation affects the tonsillar tissue uniformly, so no exudation like the previous type, but the tonsil will appear like this picture is uniformly enlarged. Okay. The third type is the acute membranous tonsillitis. Acute membranous tonsillitis, it's occur when the pus or exudation that filling the crypt in the follicular tonsillitis fuse together, forming a covering membrane over the medial surface of the tonsil, just like this picture. So here is the membranous tonsillitis. Okay, last one is the acute catarrhal or superficial tonsillitis. Here, when the inflammation of the tonsil occur uniformly over the parenchymal of the tonsil, but in addition there is association of the generalized pharyngitis. This is most commonly occur in the viral tonsillitis. Okay. Here important picture to be mentioned. This is here whitish membrane just attached to the left tonsillar and extending to the roof of the palate or the roof of the mouth. Here is we called it the diphtheria, which is a type of the pharyngitis caused by a specific type of bacteria called Clostridium diphtheria. These lead to like whitish or grayish membrane that attached to the pharynx, sometimes to the tonsil. So it is important to distinguish it from the membranous tonsillitis, as it a different situation and sometimes could lead to airway obstructions. Okay, here is the picture for it. Okay. Before we're going to proceed to the management, let us discuss important things, which is called Centors score or modified Center scores, used to diagnose streptococcus pharyngitis or that caused by group A beta hemolytic streptococcus. In these criteria, we have four main things in addition to the addition of the 3 points in the modified version of this score. So if the patient have fever 38 degree or more, we're gonna give him 1. Tender anterior cervical lymphadenopathy, we give it 1. Tonsillar exudate or swelling, also we're gonna give it 1. Absence of the cough, we give it 1. In addition to those features, then there is point based on the age of the patient. If the patient age from 3 to 14 years, we're gonna give him 1 score. If from 15 to 44 years, we're gonna give him a 0. If more than 45 years, we're gonna give him a -1. So, as interpretation of this score, if from 0 to 1, this is considered a low risk for strep pharyngitis. If from 2 to 3, this is considered as intermediate risk, and further test by doing rapid antigen detection test plus or minus the throat culture is needed. If more than 4, this is considered high risk, and at this case the investigation is mandatory, and even sometimes the empirical antibiotic can be started. Okay, so not to forget this center score for strep pharyngitis. Okay. We have the management. So the management of the tonsillitis is primarily supportive treatment in the viral tonsillitis. So the supportive treatment composed primarily of adequate hydration, good oral intake, and the management of the pain and fever using paracetamol and other non-steroidal anti-inflammatory drugs. Okay? In the bacterial tonsillitis, in addition to the above supportive treatment, we have to start the antibiotics. The first line antibiotic is the penicillin. If patient is allergic to penicillin, we have to start by choosing either cephalosporin or macrolides as azithromycin or the clarithromycin. Okay. Okay. Lastly, the complication. So, complication, we're going to divide it into local complications, systemic complication, and chronic and long-term complication. So, regarding local complication, we have peritonsillar abscess, quinsy, or parapharyngeal abscess, resulting from spreading of the infection from the tonsillar tissue to the nearby neck spaces, or retropharyngeal abscess, and airway obstruction, which is the most severe complication. Okay, regarding systemic complication, we have a sepsis, we have something called Lemire syndrome, which is the thrombophlebitis of the internal jugular vein, which is lying just nearby the tonsillar tissue on the lateral surface. We have the post-streptococcal glomerulonephritis and acute rheumatic fever. Okay. Regarding chronic and long-term complication, we have the chronic tonsillitis. This is occur when the symptoms of the tonsillitis lasting for more than 2 weeks, or most likely this is occur from repeated or inadequately treated acute tonsillitis. Next, we have the recurrent tonsillitis, when the tonsillitis episodes occur equal or more than 7 episodes per year. Okay. Other is the tonsillitis, which is the formation of the tonsillar stones, and lastly, obstructive sleep apnea. Okay. Okay. That brings us to the end of today's topic on the tonsillitis. Okay, thank you for watching. Hope you found this video helpful and see you in the next one.